Welcome to the MedTalks podcast YouTube channel, where we'll be discussing a range of topics with a focus on health and well-being. You'll be joined by myself, Mehran, and my friend Fahim, along with expert guests, to discuss things further. Please don't forget to follow us on Facebook, Twitter, and of course subscribe to our YouTube channel. Hope you enjoy the show. Hello everybody, and you're listening to MedTalks. So this is a regular radio show for Pendle Community Radio, Awaz 103.1 FM. And today I am joined by my co-host and non-biological brother, Dr. Fahim Shakur.
Hello.
Hi Fahim. Great to have you on board. And we've also got two expert guests, so I will let Fahim introduce them shortly. So again, the information that we're going to discuss is for general advice and better understanding of various health topics. But if there's any specific concerns about your own well-being or questions about your own management, please speak to your GP or the specialist doctor involved. Over to you, Fahim.
Great. Thank you for the introduction, Mehran. So I'm delighted to say that I have two GP colleagues who are spending their Thursday night with us. First of all, we have Dr. Omoduni Aboya Atalabi, also known as Danny, and also Dr. Rachel Morris. A bit about both of them. So Danny is a local GP in the Northwest, a portfolio GP with an interest in education. And she really wants to be hoping to talk about making learning work tonight. And Dr. Rachel Morris is a GP and also a speaker and a presenter for Red Whale. She has many hats and is also a podcaster as well. And we're delighted to have you both tonight. A warm welcome from Mehran and myself to you both.
Be here. Thank you.
Thanks for him.
Excellent. So I think without further ado, if we tell the listeners what we'll be discussing tonight, we hope to be discussing about resilience in the first segment up until the first break. And then we'll continue on to anxiety and palpitations, if we haven't got any of that already by then. And then moving on to home education near the end of the evening. As Mehran said, we will be taking questions as we go along, and we hope to really answer all of them as much as we can tonight. So, Rachel, can I come to you if you don't mind first? You're obviously a resilience expert, I know. Can you tell us a little bit about what resilience is?
Oh, difficult, isn't it? Because I think resilience encompasses so many different things. It's really hard to pin it down. The best definition I've come for resilience is bounce back ability. So actually, the ability to deal with everything that life throws at you and bounce back. But then I've heard people say, well, actually, it's not about bouncing back, it's bouncing forward. It's about learning from what's happened and being able to deal with it and actually move forward. So that's sort of one of the definitions. And all the other stuff is around, actually the ability to live, the ability to persevere, the ability to maximize your own well-being, reduce your own stress. It's a bit of an all-encompassing word, and I don't actually like it very much. I have heard it described as resourcefulness, and I think maybe resourcefulness is a better word than resilience.
I think resilience has really taken on board, especially over the past decade, hasn't it? Because I think previously it used to be considered as quite an intrinsic, very person-specific trait that was quite stable. But I think we've better understood what factors can influence resilience. And I think it's more about process and outcome orientated now. Is that fair to say, Rachel?
Yeah, I think it's definitely about skills. And the great thing about skill, they can be learned. So I spent many years working at Cambridge University. I started as a assistant director of GP studies, and then I moved on to teach professionalism. And along the way, did some communication skills teach. And sort of 30 years ago, we used to communication was innate, that either you could communicate or you couldn't. Some people that were brilliant at it, that some people weren't. But actually, through a load of research and through teaching it, we actually know that communication is a skill that you can learn, because the great thing is skills can be taught and learn can always get better at them. And I think that's exactly the same with resilience. People think it's innate, and I guess there are some people with higher innate levels of resilience, like there are some people who are at communicating just naturally. But the good news, I think, for everybody is there are so many things that we can do and get better to make ourselves more resilient. So good news all round, really.
That's great. Danny, obviously in your working life and personal life, I'm sure you're employing resilience in many ways. Can you share with the listeners tonight how it actually factors in your life?
Okay, so in my life as a professional, I see lots of patients, and sometimes you need to assist them with the varied presentations they come with. When someone comes to you and shares a concern, a problem, you are all human. We would understand and empathize with them, and sometimes it can affect you. You need to balance that and not take it to the next patient, the next task you need to do. So from that point of view, in consultations, that's very useful, the resilience. Also, in your role as a human as well, we've got lots of things going on every now and again. There's always changes. I mean, we never knew that there will be a COVID, and now we're faced with it. So we need to be able to adapt. We need to be flexible. That resilience needs to come through. So being able to cope with that is also useful. Family life as well. So those are things that I have employed resilience to help with that. In my teaching career, I have students for clinical debrief, and one of the main things is resilience, because during clinical debrief, they see these cases on the wards, they see these patients on their placements. Sometimes they see some ethical situations that they are concerned about, and they need a place that they can debrief and build that coping strategy or flexibility or adaptability to it. So in those areas, I've had to employ resilience tactics to address.
But I think it's fair to say that there's obviously that individual resilience is key, isn't it? But at the same time, you need that community resilience, you need that organization resilience, you need that capacity to perform an experiment, but also have that peer support. So there's many arms for addressing or promoting resilience.
Yeah, I think you see this in organisations. Do a lot of work with doctors, not just in the NHS, but also work with other organisations, and you can definitely see different cultures that have different levels, different sort of company cultures that have different levels of resilience. Often I'm asked to come and work with the groups because everyone's getting very moany. No one's solving problems for themselves. People are starting to go off sick. And I think, we were seeing this a lot certainly in the health service. I think there's a lot of cultural stress within the NHS as well. I mean, I think obviously with COVID, it's unprecedented, isn't it? Mm. But it's a really good observation that resilience, it's not no man island. Resilience is not just, you can't be resilient on your own if everything else is resilient. We're all interconnected, and where we work, just as what home life is about, will affect us in so many different ways. And I think when we start to compartmentalize life and say, well, I'm going to be okay in one area and it won't, but if I'm not in the other area, it won't affect this area. Well, that's rubbish.
Welcome back, everyone, to the second segment. We're moving on to anxiety and palpitations. Danny, can I ask you, we've got a question from our regular listener on anxiety. What are the causes of it and how can people tackle it?
Right. Okay. So anxiety, first of all, is a very common condition. And I'm sure that each and every one has come across, either personally experienced anxiety or know someone who has. There are a few factors that can contribute to it, which are mostly external factors. And you can have things like stress, most commonly stress. Different things cause stress for different people. So sometimes it could be, I don't have enough money at the moment, or I'm worried that I might pick up an infection, or I'm worried that something bad is going to happen. It could be, if you're a student, you're worried about exams, and that stress can sometimes cause you to feel uncomfortable. In relationships, people have stress as well. And whether married relationships, friends, or even school, and those kind of things can cause you to feel quite anxious and quite on edge. So it's quite a lot of things. And some people, medications can also kind of cause that to come on. So we have very commonly some over-the-counter medications, or even street drugs as well. They can make them anxious. Yeah, so those are some very common causes of anxiety.
I think it's important for the listeners to understand how does anxiety actually present itself. So there's different ways it can present. It could be a physical manifestation. It could be an emotional manifestation. So physical could be about hot flushes, breathing faster, feeling quite restless, pins and needles, feeling quite lightheaded. And I guess the emotional aspects is that you feel quite tense, nervous, have a sense of dread, fearing the worst. And I think these are kind of some of the symptoms that we're seeing a lot more given the current pandemic and the current circumstances, where we feel helpless. And despite how much we try to educate and inform people about understanding helplessness and how we can counter that by being more productive, we have to be clear we are helpless, that this is a situation that we have to accept and try to move on. But those are the kind of two key areas, I think, for listeners especially to be aware of in terms of how it can affect you.
I normally explain to patients when I'm talking about anxiety with a scenario. So imagine we're both in this room and we're talking, and a lion comes in. What are you going to do? Are you going to say, "Hi, kitty"? No, you're going to be looking for the nearest escape. So you probably will have your heart beating very fast. And all that comes from the fight or flight chemical released in your body, and all the stress chemicals that are released in your body. And I mean, it's such an amazing system which helps you run away from lions if you can't fight them. But in this case, with anxiety, there sometimes is no lion, and it just comes on. And it can be as a result of built up stresses, either from different aspects of your life. And it becomes overwhelming. People present with palpitations, they present with chest pain. Sometimes it gets to a point that they've had this feeling of doom. I'm going to die, or something like that, which is quite overwhelming and terrifying. So that's about the main things that I kind of say about anxiety, and it kind of makes them understand that chemical is just moving around and causing this kind of symptoms. And sometimes that can help. Having that in mind helps guide you on some medications that are given for symptomatic control.
I think in terms of treatment for the public as well, in addition to medications, as you mentioned, there's many practical things they can do. The nhs.uk website has Every Mind Matters, and there's many good resources there explaining about good sleep, planning ahead, sometimes taking a break from the news. So we're not totally engrossed in this pandemic 24/7, having regular breaks, along with doing exercise as well. All of these things is going to be helpful for the general public, along with staying connected with others and sharing information, and for people you trust, and opening up to them about some of your worries to people you trust. Rachel, any thoughts on other tips that maybe the listeners out there can employ?
Yes, I think with anxiety, it's interesting, isn't it? So because it's a massive range of experience. So some people are experiencing like a lion in the room when there isn't a lion in the room, but some people who don't have bad anxiety are still experiencing more anxiety than they would like to. And I think particularly at the moment, there genuinely is something to feel anxious about. So whether it's something that we genuinely do need to feel anxious about, or it's something that actually it's sort of just coming on, are things that we can do. And some of the things that we've been talking to people about is, like you said, I think firstly is limit your limit the thing, the social media, for example, right? In the crisis at the moment, we're obsessed with our phones. We're checking it all the time. We're checking the news. We're doing it all the time. Emails coming at us, constantly checking. Actually, a good thing to do that we're in control of, and this is what I talk to people a lot about, we need to take control as we can control and try and accept the things we can't control. If we're in that zone of power, the stuff that we can control, then actually we're much more productive, much more powerful. So limiting your exposure to social media, we know will help us. Another thing I sometimes suggest is I used to do with my daughter, and it's called worry time. So when she was getting a lot of anxiety, we read a really good book, I think it was called Starving the Anxiety Gremlin, something like that. And basically, whenever she started to worry, we'd say, hey, you can worry about that. That's fine. It's very important to worry. But you know what? It's not worry time yet. We'll put it in the worry box. We'll put it in, and later on this evening at 7 o'clock every night, I will come into you and we will have a worry time, and we'll worry about everything. And actually, by the time we got to that worry time, half the time to worry about it anymore. And I do that for myself. If I find this going around my head that I'm really ruminating about, I'll sometimes say to myself, you know what? I'm not going to worry about that now. We'll worry about that at 5 o'clock this evening. And I write it down on a list at 5 o'clock. Most times I go, oh, actually, what was I worried about? Things are completely fine now. And I think sometimes we just ruminate on things, and actually we just need to put a lid on it, distract yourself, go and do something. So that's just a couple of things I think could be quite helpful.
Yeah. There is this very interesting phenomenon I came across. It's popularly known by one of the American neuropsychiatrists. It's talked about automatic negative thoughts. They're called ants. So there are things that just pop into your head, or maybe I'm not good enough, something bad is going to happen, and you just keep ruminating. So it can come in with anxiety, it can come in with depression, it can come in with many not quite helpful thoughts. And so it was suggested about addressing them. You find out, ask the question, if this thought is true, 100% true, and if you believe that it's 100% true. So those are ways that you can kind of question those thoughts. They talk about a terminology, killing the ants. So challenging these thoughts. I think that's a useful strategy that can be used in addition to writing it down, because what you share, what you put down, it's taken away from your head. Try to put it on paper, which is a very good strategy, I would say, Rachel.
Yeah, I love that thing about killing the ants. I've not heard them described like that, because I know that it's really important that we understand that our thoughts are necessarily true. Right? Thoughts happen to us all the time. We're constantly things going in and out of our heads. Just because we're thinking them doesn't mean they're true. Actually, just because sometimes our feeling, yes, we're feeling something. I'm feeling a bit anxious, therefore there must be something. Or, and I listened to a really interesting TED talk by a gastroenterologist, and she says that sometimes she wakes up in the night feeling really anxious. And she's done quite a lot of research into gut biome. And now her first thought isn't, oh, what's wrong? Why am I worrying? Her first thought is, well, what have I eaten today that's making me feel a bit sorts? Yeah. So, everything is connected, and just your feeling anxious doesn't necessarily mean that there's there's something wrong. Because you're having those thoughts doesn't mean you need to believe them or take notice of them. And one really great technique that was read in a book called The Happiness Trap, which is really fabulous book. It's all about instant commitment therapy. Is that we start to, whenever these thoughts to our head, we go, oh, I noticed that I'm having this thought. So labeling it as a thought, I notice I'm having the thought that I'm no good, or I notice I'm having the thought that, and it just sort of takes the power. And then I guess you could choose whether to fuse with it, or you don't need to take those ants, those negative thoughts, and go, I must look after this ant. Let's just hold it. Because actually, our brains think of weird stuff the whole time, and we don't, So for me, that's been really helpful. But knowing that my thoughts aren't the truth.
Yeah.
We're getting some more questions through. I'm going to leave it open for him. Happy to take it, hear your thoughts on it. But one of the questions is about OCD, so obsessive compulsive disorder, can cause anxiety. Is there a way of changing OCD habits or preventing OCD? I guess the preventing OCD, but you don't really know whether you've prevented OCD until you have it. But, there's obviously relapse indicators and making sure that you're taking your medications or whatever therapy that you're currently having to ensure that you manage this appropriately. What do you guys think to that question?
I think it's quite a pertinent one because, just for the audience, OCD is obsessive compulsive disorder. And I think I'm quite obsessively hand washing at the moment. So in many ways, that would fit the criteria because I'm doing 20 seconds hand washing far often than I used to. But that's normal for what the situation is. So therefore, it wouldn't be classified as a disorder as such because it's within the norm for now. I think that should be, perhaps I'm thinking as to how that question came about in case someone was worried if they were doing that quite often. But I think that's, first of all, let's allay that anxiety, and that's not the issue. So my thoughts are really, obviously, the issue of hygiene is now going to be something that we're all very interested in. It's now become something that people could have been lackadaisical about before, thought about, well, does it really matter? Maybe the 2-second rule when the toast goes on the floor and things.
Oh, it's 5 seconds.
Surely.
It's 3 seconds for me, 2 for everyone else. But I guess even just to use that as an obvious example, I think we're all very fastidious now in terms of hygiene and just cleanliness in general, in terms of cleaning products. Even on the few times I go to a supermarket, I'm even washing the packaging because that's actually reducing my level of anxiety. So I think it's about the situation we're in now, though, in terms of actually the OCD thing. But I'm happy to listen to other people's thoughts on this.
I'm aware that when people have OCD, apart from medications, they also have things like cognitive behavioral therapy that is made available. So it's a kind of talking therapy whereby you think about why you're behaving the way you're behaving, and it's just with the aim of changing that pattern. So I think it still comes down to a similar situation where you are challenging your behavior. You're understanding why you're doing what you're doing, and then you challenge it and say, right, should I really wash my hands? Or no, maybe not wash my hands, but lock the door and keep checking that I've locked the door every 2 seconds, something like that. So I think with that in mind, I think that's where CBT comes in, because it's quite similar to addressing your thought process.
Yeah, and I guess it also challenges your thoughts by actually the actions and the outcomes that you face from it. So it's just a very much a connected cycle. So that's great. Thank you, guys. We're going to take another short break, and after this, we'll be touching on education and again appreciation of teachers in this next segment. So bear with us. Welcome back, everybody. So it's the last segment of the Med Talks radio show at Pendle Community Radio, WAS 103.1 FM. So this segment, we want to try and focus a bit more about education. And I guess I can kind of relate to this from a personal perspective. So from the point that my 5-year-old's school got closed down, I had this amazing, timetable, schedule, everything was all set. Start at 9, finish at 3, breaks, everything was all regimented. And then that lasted probably about 24 hours. Because I just did not take into account the 2-year-old that was, accompanying the whole education process. But, everyone's got a take on education, what this means as currently in coronavirus. But I'd like to take your thoughts, Denny, on this.
Okay. Well, first of all, I'd like to say that it's been quite a change. It's very dramatic. No one saw it coming. I've got this group of it's predominantly moms of my children's class, and there was a very interesting thing where they were reporting what's happening from the different homeschools that are going on at the moment. And I said, well, I think at the end of this, 2 things are going to happen. One, it's either you think, I think I'm going to go homeschooling now because I really am good at this and I really enjoy this. Or you go with the second one, which is, well, that teacher, I'm going to give a very big hamper to every term. So having said that, it's very, very interesting that, especially with the schools, they give them a structure, which is very good. And it's kind of guided around the curriculum. But remember, this situation is different. You are at home. You are their parent, and you are anxious, and so are they. You need to remember that your children, they love you so much, but they also love to see their friends. And while it's good to say bye mom, bye dad, and go to school and come back, hi, and they are very happy, they're stuck with you for a long time, and so are you. So I think being aware of that, we need to be kind to each other. We need to kind of relax into it. Don't say, well, 9 to 3, here it is. Okay, it's time to start your work. No, relax. This is a very good time. You need to start off gradually, see how it goes. Very, very important. You need to listen to the child. You need to feel the vibes of the child. I mean, you know your child better than anybody else. So you can see the body language. Oh, I don't feel like getting up now. Sure. Do you want to have a lie in? Let's see what we can work out and kind of reach some ground with them, which is very useful because they're going through a lot of stress at the moment as well. They may not voice it out, but it is quite a stressful moment. So yeah, I think those are the kind of first things I would suggest. There's the funny thing I do with my children. So I've got a 7 and 9-year-old. In the morning when they wake up, I let them wake up. I don't wake them up. So I let them wake up after they've had a good number of hours of sleep. So when they wake up, they do the usual things, get ready like they're going to school. I prepare their breakfast and I say, right, so children, you're off to school, right? Okay, bye, mom. And they pick up their bag. Bye, mom. Walk to the door and then walk back to me. Hello, teacher. And even though it may sound silly, I think it's kind of adds a bit of fun to it as well, because they look at it as, oh yeah, so let's get that experience. And also being a bit organized as well. So you've got most schools have provided parents with a schedule. So with that, you need to go through it with the child, not on the day you're doing it, but the day before or sometime before. Well, what do you want us to cover? Something like that, especially when they're older. And that's very useful.
I think the worry that I have with homeschooling is is the risk, especially of disadvantaged children being in that kind of environment. And I guess disadvantage is a very broad term, but if we clearly state that whether it's the student or the environment isn't able to reach that kind of expectation to provide in terms of resources, in terms of time, and sort of stability, my only worry is that by the continued lockdown, are we putting them at a greater jeopardy? I don't know whether you all have a similar view or a different view on that.
I think it's really tough. I have a friend who's a special, she's a Senko in a secondary school, and she's really worried because I think, most people are trying their best to make sure their kids are getting what they need to and at least getting something done. But there are some parents who, through no fault of their own, aren't able to do that. Might have other younger kids at home that they have to look after, or they're their own. They might have drug and alcohol. They might have all sorts of issues that mean that they're not there to give the supervision that's needed. And I think there are some kids that are missing out on an awful lot of education right now because they don't have someone forcing, if they go to school, at least the teachers are looking over their shoulders, forcing them to do it. And some kids that might not have access to laptops or so I think there is a risk that some kids are going to be quite advantaged through this time.
I think you're right in the Senko, obviously the special educational needs coordinator that you were talking about being part of the groups that need it. From my own research and reading on the topic, it seems like there's a general consensus from the teaching unions of no more than 3 hours of work a day, which depending how you look at education is a lot or not enough. So depends how what prism you look at. But also it's a case of getting the children into a routine, because there will be a time when they go back to term, and if they're waking up in the afternoon, they're going to struggle. And there is a general acceptance that during a summer term or summer holidays or Easter, children fall back a bit. So if they're falling back quite a lot, it's always remember that, get them into the good early habits and routine, because you're not going to be replacing the teacher. We've already discussed that, but it's a case of actually making sure you're fostering the good habits during the time you do have them and savoring that.
Yeah. We've found that our kids do much of the routine actually. So when schools first shut, we were like, okay, just with some work. I have teenagers, and that daily work, my son seems to be on his ex rather a lot. But actually now we said, right, okay, break at this time, have a break here. When you have a break, go and do something completely. Go and chuck some balls through that basketball hoop in the garden or something to turn your brain off. We'll have lunch at this time. Just some sort of structure to the day. Helps them feel a bit more secure, I think, with all of that.
Absolutely. Yeah, that's very true. You have to break up your day. I know they've got like English or maths or certain subjects, but when you just keep hitting on with, okay, you have to work for hours with no breaks, it is counterproductive. There's this technique, a Pomodoro Technique, and I found it very useful because it does help you with learning what you need to learn, but also helping you to disengage from it, move to something else, which could be throwing the basketball through hoops, or bring out the Lego game and play, or just run around, or just do something fun. And then by the time a child finishes doing that, you come back and continue with the next thing, or with whatever task it is that they need to complete. That does help them with their concentration. If you notice in schools, especially primary school, they usually have quite a few breaks in the day. So they have a morning break, and then they have one after school dinner, and then they have one in between the school dinner break and the closing time. So they do quite a bit. So adopting that kind of style, or even something more fluid, like more frequent, if you see that the child is not concentrating, because it's going to just be very difficult for the child just going at it. And for you as well.
Yeah, I think remember that actually taking breaks is really important for resilience for all of us, not just for the kids. And I think in lockdown, the tendency for us who are working at home is to just put your heads down, power on through. Whereas before, if you were, you'd have walked off to the coffee room or, you know, have gone to the shop for a sandwich or something like that. We don't do that anymore. We're sort of often stuck in quite enclosed spaces, and remembering to turn off the screen, go something else for a bit. And the more we can do that for ourselves and model that and help the children out as well, I think the better.
Yes.
I think as parents, we've got to try to be a bit flexible. If your child wants to do certain things in a certain time or in a certain way, work with it, see how that works out. And then, you know, I'm constantly in a negotiation with my 5-year-old, and then the 2-year-old gives his own opinion. Most of the time, but I think it's key. I think breaks is very important. I think also socializing as much as possible is quite therapeutic. You know, people are using lots of play dates, whether it's through platforms such as Skype or Zoom meetings. You know, some of the children in my 5-year-old's class have not had birthday parties, so we try to do things that way. So there's that kind of cohesion element and that kind of togetherness, which I think is quite nice to see that people are still willing to work that way.
Absolutely, yeah.
We've had a question come in, so we're approaching near the end of the show, and with tradition, we do like to obviously actually complete the show with a couple of points that you both would like the listeners to take home as well. But let's deal with the question prior to that. The question goes, does this panel have any good teaching methods, and what's the most memorable thing they have learned from their teachers? Let's start with you, Rachel.
Oh my word, me, no chance to think. Do I have any teaching methods? I hate to say this. BBC Bite Size. I've abdicated all my. Go to the. I'm a big fan in life of delegating to experts. So getting help, getting the people. So many resources out there. So that's my big tip about teaching. And what did I learn from my teachers? Oh crumbs! That has floored me, because I think the one teacher that was really good was a good laugh, good fun, but she was actually quite strict. So she really cared about us, but you did not cross her. So I think boundaries are really, really important for kids, but love, but with the same amount of love, and boundary love, I think is the best way to do that. That's from me.
Right. Concerning the best tips, I think, for learning, from my point of view, you need to make learning fun. It has to be fun, or it's not going to go in. Or even if it goes in, it's not going to stay in. So I try to make my learning fun, my children's learning fun, my students' learning fun. It just has to be fun, or else it's a bit difficult, and the resistance is there. I had a wonderful physics teacher, and one of the things I really enjoyed about the learning experience was not just going through the theory of physics, but he went through the practicalities of it. So it was more learning the theory and applying it to your everyday life, which was just so good. And for that reason, not only did I learn the theory, but when I want to remember a concept, I remember either the example, the story, or the life experience or something that I did to show, say, one of the laws of Newton or something like that. So it was very practical. So that practicality helped me learn better from that teacher.
I think there's lots of information on the gov.uk Department of Education for online resources. As you mentioned, there's BBC Bite Size, but there's lots of different segments. So if it's about physical activity, what kind of programs is it worth looking at, like Boogie BBs or Disney 10-minute shake-ups? So there's lots of things for people to review and reflect whether that's suitable for them. So, there is a lot out there.
Yeah. I think a lot of people are aware of the Joe Wicks YouTube thing.
We all love Joe.
Yeah.
I think we covered him a couple of weeks ago, didn't we?
No, that's true. It keeps
Yeah.
popping up.
He's coming. I'm just going to share just in terms of things that my teachers taught me that I found really helpful was packing my bag the day before. I remember that over 20 years later down the road. I don't want to give away my age just yet on the radio, but I do remember that. And it was actually not just the concept of packing the bag, which physically made a lot of sense. So you're not in a rush when you actually walk out the door, but you can actually philosophize and actually meaning the whole concept of preparation. That's what he was trying to instill into me, but he used that as an analogy as well as the actual literal meaning. And really, I've not forgotten it at all. And it's always helped whenever I've prepared properly.
Yeah, and I guess I can name check my teacher, Mr. Fuller. He was, a bundle of laughs and did a great deal for our school. But the one key thing that he was able to understand was a student's capacity, and he always used humor to try and nurture that kind of capacity. So I think it's always key to try and see what the safe areas for individual students and what try to stimulate them to be better. So I think there's lots of different strategies, but and it's great that we still remember our favorite teachers.
Yeah. So the top 3 learning points from today, the take-home points, Rachel. We've covered a lot today, obviously, in terms of the 3 segments. Is there something that you really want us to actually remember?
Well, I think my top 3 points from what we've talked. Firstly, realise that our thoughts are just thoughts. We don't need them necessarily. Number 2, recognise you're good enough and give yourself a break. And then number 3 is literally give yourself a break. Take breaks and make sure your kids take as well. Little and often. Those are my top 2.
Great. My top 3 takeaway points. Number 1 is be kind to yourself and everyone around you, your children. Rest. Don't put so much pressure on yourself. Okay. The second one is to share the task or the burden. If you're going through something, share it with someone. If you feel that you're struggling with something, let someone know and interact. Get a community, a support community around you that you can share things with. And number 3, my favorite, laugh more. It's the best medicine.
Absolutely, 100%.
That's good. Mehran, anything you want the listeners to take away?
I think just about a message of hope and reasons to remain positive, really. Using various sources, Statista.com, they've highlighted how about 700,000 people have recovered from COVID-19. We can always relate to Captain Tom Moore and what he did for the NHS, but not just that, but just about bringing cohesion to everyone around, irrespective of their race, their creed, their religion. Everyone kind of appreciates what he did today and what he did in the past. And just about the fact that the lockdown is making us more neighborly. I think there's clear evidence of that, and I think that's certainly something that I would like to see continue and persist and develop, really. So I think those are kind of reasons for hope and just having a positive outlook.
Excellent. On that positive note, I'm going to draw proceedings to a close. I want to give my big thanks to all the guests, so Dunny and Rachel, for coming on tonight, sharing your wisdom, your experience, your good words with the audience, as well as my co-host Mehran. Always great to have you along. Couple of things before we do go. Thank you again. This is on Pendle Community Radio 103.1 FM, Awaz FM, and we're back on next week at an altered time for Ramadan. So we're changing to Saturday 5 to 6 p.m. during Ramadan, and the next show is on the 2nd of May. And we have 2 new guests, Dina Begum, who's a well-known chef, writer, author, and also has her own YouTube channel, and she specializes in Bangladeshi cuisine. And we also have Dr. Shazli Azmi, who is a diabetologist, a diabetes consultant. So hopefully we'll be talking about diabetes, obesity, some Ramadan reflections, and in addition to that, maybe some nutritious offerings over that month as well. It's been great. Again, I really loved every minute of the show. And thank you once again, and have a good and pleasant evening. Thank you so much.
Thank you.
Thank you.